Good evening. Thank you for joining us. I'm Leah Hollins, the chair of the Board of Directors of Island Health. I begin tonight by acknowledging with respect and gratitude the Lekwungen peoples of the Songhees and Esquimalt First Nations, whose lands we are virtually visiting tonight. I also thank the Vancouver Island First Nation families of the Coast Salish, New Chelnith, and Kwakwakiwaks people who have cared and nurtured the lands across the areas we serve for all time. I recognize the Métis, Inuit, and other Indigenous peoples who live in communities where we deliver health and care services. As a board, we recognize the harm of colonization and systemic racism and are committed to surfacing the truth. Our collective responsibility is in participating in reconciliation and the delivery of culturally safe health and wellness care. Tonight, my co-host will be Kathy MacNeil, President and CEO of Island Health. Kathy?
Thank you, Leah, and thank you everyone for joining us on this beautiful spring evening. It's my pleasure to introduce tonight's panel. Dr. Dee Hoyano is the Medical Health Officer for the region, and Dee will provide a public health update. Dr. Hoyano has been a critical member of our public health team who has helped guide us through the past 2 years of this pandemic. I know I speak for many people across our region in saying thank you, Dee, to you and to the members of your team for helping guide us through these past 2 years. Elin Bjarnason is our Vice President of Clinical Operations for the Capital Regional District and Cowichan Valley. Elin is the executive responsible for services in the region, and she will provide insight into our acute and community health programs. Each of our program areas has an administrative and a medical lead role, and the last two panel members both hold one of these roles. Keva Glynn is the executive director of the Mental Health and Substance Use Program, and Dr. Leah McDonald is our executive medical director for primary care. We know in Victoria and in many communities across our island, people have many questions about mental health and substance use and primary care. Both Keva and Dr. McDonald have been working closely with partners here in Victoria on these very issues and are here tonight to help answer any questions you might have.
Thank you, Kathy. As a governance board, we are accountable to you, the people we serve in the various communities around Island Health and the Gulf Islands. And it's why it's so important to provide opportunities like this to hear from you. We have 10 board members, and although they are not on the screen, they are watching tonight alongside each of you. They include Diane Brennan from Nanaimo, Shawnee Cassavant from Hupuchaset and Seychot First Nations on the West Coast, Ann Davis from Comox Valley, Ann McFarland from Victoria, Ron Matson from View Royal, Alana Nast from Victoria, Ron Rice, a member of the Cowichan tribes who lives in Victoria, MJ Whitemarsh from Sydney, who you will hear from shortly, and our newest board member who was appointed earlier this month, Vivian Hermanson from Snuneymuxw First Nation, who lives in Campbell River. Board members are appointed by the Minister of Health, but the reason we are here is because we care deeply about the health and care of the communities we serve. For me, as a former public health nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, my focus has always been on doing what is right for the patient. Each of our board members has their own reason for joining the board, and tonight I have asked MJ Whitemarsh to say a few words of welcome from the board of directors and to share her commitment.
Thank you, Leah, and good evening, everyone. I am grateful to reside on the traditional territories of the Saanich people in Greater Victoria Region in Sydney. It has been my privilege to serve as a director of Island Health since 2016. As a business person, I understand the link between health and the economy, how the health of individuals like ourselves enables us to build strong, vibrant communities. Never has that been felt deeper than during the pandemic. It is really important to our board that we deliver health and care for patients and clients' families, that in doing so, we support all of those who deliver our care. Our healthcare workers are truly amazing. Tonight, I'll be watching this session alongside each of you and look forward to hearing your questions. Enjoy.
Thank you, MJ. Tonight's discussion will help the board better understand what matters to those living in the Greater Victoria area and to gain a broader understanding of health and care needs. We'll begin tonight with a local public health update from Dr. Hoyano, and then Kathy will provide an organizational update. Then we'll ask Keva, Dr. McDonald, and Elin to respond to both live and pre-submitted questions related to the Greater Victoria area. If you didn't get a chance to submit a question ahead of time, you can submit a question now in the chat on Facebook or YouTube. I'll now invite Dr. Hoyano to speak.
Thank you very much for the introduction, and welcome to everyone who's joining us tonight. First, I'd like to take a moment to acknowledge that I'm joining you right now from the unceded territory of the Lekwungen-speaking peoples, the Esquimalt and Songhees First Nations. And from this territory, I've had the privilege to work, live, and raise my family for many years. Tonight, I want to provide an update on a number of current public health issues of significance affecting the South Vancouver Island region. First, about COVID. Since the peak of COVID-19 Omicron activity in the early months of 2022, we have seen promising declines in COVID activity, as well as a reduction in serious and severe outcomes from the disease. This is due to the excellent protection that vaccination provides against severe illness and death, which we are continuing to see in BC, as well as overall reduced severity of the Omicron strain. As of March 31st in Island Health Region, we have 6 active outbreaks in long-term care facilities and 43 people in hospital with COVID-19 infection. Our hospitalization rate has dropped to an average weekly rate of 4 per 100,000, which is the lowest rate of hospitalization in BC currently. We peaked in early February with a weekly rate of around 15 per 100,000. Our death rates similarly remain low, although we still continue to see and expect some deaths due to COVID-19 infection, as it will remain part of our circulating respiratory viruses. We know that unvaccinated people, particularly those with chronic medical conditions and those of advanced age, remain at highest risk of severe illness and death, which underlines the continuing importance of vaccination to protect those at higher risk of severe illness. We have been so fortunate to have the benefit of vaccination and a very high rate on Vancouver Island, and in particular the South Island. But it's important to acknowledge that we are still in a process of change, adaptation, and recovery. We may see some increases in cases and hospitalizations over the next weeks and months as we encounter evolving variants, but we are in a very good position with our current levels of immunity through vaccination and recent infections, as well as availability of treatment to prevent severe outcomes for most. We are now able to stop many of the public health measures for the general community, and as you are likely well aware, this has been occurring gradually over the past few months in BC, and we are expecting further changes in April. What this means in practical terms for so many people is the opportunity to re-engage with many activities and plans that have been put off or altered during the past 2 years, which is wonderful and a key part of our walk towards recovery. The collective experience we've had over the past 2 years has been a unique and transformational global event. Nobody has been unaffected by COVID-19. Many have been living with ongoing fear and anxiety about COVID-19 illness, as well as the challenges and frustrations from the ongoing changes to our daily lives, from reduced mobility and travel, limits on social interactions, impacts on businesses and work, the healthcare and education systems, and public services across the board. We are still in the process of adapting psychologically, behaviorally, and it has been exhausting and taxing on everyone's energy. I wanted to say a few words about recovery, which is a critical stage following any major disruptive event. The COVID-19 pandemic is no exception, but we need to recognize a few key factors in this particular recovery process. One is that COVID-19 as a virus looks as if it will be part of our global reality for the foreseeable future. So we will need to adapt to living with the virus as we have had to other respiratory viruses. We also need to recognize that the impacts of the pandemic are mostly invisible, and as such will be harder for us to recognize and characterize as time passes. Unlike a major natural disaster like a hurricane, which leaves visible wreckage, as well as a clear community focus for rebuilding and recovering, this pandemic and the measures and changes that were adopted to deal with the virus has impacted remarkably broad aspects of our existence, from the way we live day to day to global systems of economy and politics. So we need to acknowledge that there's still a lot we don't know about the ripple effects of this experience, and that recovery is going to be complex. It's not going to be a complete return to normal, which I would argue isn't what we should be aiming for in recovery in any case. Instead, we're adapting to a new way of living with the virus and all we have learned from the past 2 years and are continuing to learn from. There are a few problems that we already know have been exacerbated by the pandemic experience. They were already very much part of the challenges we have been grappling with prior to 2020, but undoubtedly have been worsening over the past years. The toxic drug crisis, which was declared a provincial public health emergency in 2016, and has unfortunately been getting worse at an alarming rate. The most recent BC coroner report that came out this month reported that in January 2022, there were 207 drug toxicity deaths in BC. That's an average of 6.7 deaths per day over the month of January. And this is the fourth consecutive month with 200 or more suspected deaths. This number is staggering, and we know the problem is incredibly complex. The solutions equally will need to involve all of society, not just the mental health and addiction system, and look at preventative and rehabilitative work across society. Housing, meaningful work, social connection, psychological support, all are parts of the solutions we are seeking. Closely related to this crisis and the bigger issue of addictions is mental health. The pandemic has not been a positive contributor to mental health for the vast majority of us, and those who went into the pandemic already vulnerable to mental health challenges have not had an easy time. One group of particular concern are young people who were affected by the pandemic in a myriad of ways. Not only was education disrupted for many because of the changes made in the school setting due to COVID, but also equally as important were the impacts on family and social lives. Many children spent less time with extended family members, particularly elders and grandparents. Many had their social interactions with friends altered significantly because of limitations on gatherings, extracurricular activities, and practicing social distancing, physical distancing in small bubbles. Many had to live in households with added stress that their adult family members were facing. And these all affect the social development and social connections of young people, which has a real impact on their mental health at critical stages of their development. This isn't to say that what people did was wrong for the time, but we need to recognize the impacts and take steps in recovery to restore some of those things that were lost or damaged. For the sake of young people who are building their lives, growing and learning, and need a solid foundation of mental wellness for their whole lives. The other ever-present and pressing public health issue facing us is global climate change. The pandemic showed us that we as a species and society can change some things incredibly fast. Our natural environment, new viruses included, will also continue to change, and that is something that we simply cannot ignore nor pretend that we do not need to adapt. Over the past few years, we have seen some devastating climate-related events in BC and on Vancouver Island. The flooding in the Cowichan Valley, Fraser Valley, and interior BC last fall, the heat wave last summer, and the wildfires of last year, 2017 and 18, which created not only local dangers, but also affected air quality across a huge geography, were jarring examples of how vulnerable we all are to these natural events and how we must prepare and adapt now. If we want to prevent harms to our health, we need to address them now boldly and with clear vision and clear resolve. But if the pandemic has taught us one thing, we cannot predict the future with precision. What we need to do to address threats such as climate-related harmful events, as well as novel viruses, is operate under the assumption that things will happen. We just don't know exactly when, and bolster community resilience and creativity now. And what to do about climate change specifically? A lot of this will depend on the individual actions each of us decides to take on. Island Health as an organization has adopted climate change as a strategic priority and will be looking at its role and contributions it can make to climate adaptation. We need many people with the scientific and technical skills to assess the specific risks we will be facing on Vancouver Island and the creativity to come up with solutions. This may or may not be your particular role, but all of us as citizens can support and advocate for community resilience measures for climate change. Municipalities, First Nations communities, local, provincial, and federal governments, community organizations, businesses, public services, all of these players will contribute, actually need to contribute to our societal response, and they need to hear your support for climate resilience measures, starting first at the community level. These resilience measures will be a combination of small, hyper-local adaptations, as well as larger scale measures to reduce our environmental impacts and prepare for risks. We need them all. We also need to pay close attention to the community part of community resilience. Without community, individuals cannot come together to work towards common goals. Without community, people don't feel attached to the place where they live and the people they see every day. We are seeing how the pandemic has damaged our social connections, as well as people's sense of belonging to community. A recent Angus Reid poll showed that this connection with neighborhood is particularly felt by younger adults under 35. We need to be making conscious efforts to restore and rebuild communities. It's a vital part of our recovery. But this is the fun part. The thing is, being social and active in the community is a very enjoyable and natural activity for most of all. So I encourage each of you to take a concrete step in the next week to reach out and create a new social connection. If possible, make it a cross-generational connection. Maybe it is to a friend you've been out of touch with. Set up a time to meet face-to-face with them. Organize a neighborhood party or gathering. Volunteer for a community organization that needs help right now. Just commit to one small action for community in the next 7 days. As a public health physician, consider this my social prescription to you. It's going to be good for you, for your community, and for our collective health. Thank you very much and good evening.
Thank you, Dr. Hoyano. I look forward to taking your challenge this week. I also want to extend the board's deepest appreciation to the public health team and the work of yourself and the other medical health officers. Now I'll ask Kathy to provide an organizational update.
Thank you, Leah. As Dr. Hoyano has said, for all of us, the past 2 years have been unprecedented. I want to thank each of you for remaining calm, being kind, and keeping each other safe. The recent easing of restrictions sends a signal we are moving into another phase of this pandemic. As Dr. Hoyano has also shared, we're seeing fewer people requiring hospitalization, reduced outbreaks in long-term care, and the demand for testing has slowed. However, COVID is still circulating in our community, and if you haven't yet, I urge you to get your vaccinations and booster. They are the best protection against serious illness, and they are available at your local community pharmacies. We are so grateful to everyone who stepped up to be vaccinated and to those who have staffed or volunteered in the vaccination clinics we ran. As Dr. Hoyano mentioned, we expect to see more mental health challenges due to the stresses resulting from the past 2 years. We are responding by improving supports for people in need of mental health and substance use services. In the Greater Victoria area, clients and patients identified the need to create a better care environment and improve the patient experience in the psychiatric emergency department at the Royal Jubilee Hospital, often referred to as PES. In response, we've started a peer support program, strengthened follow-up after discharge, and improved access to community supports. A key part of improving mental health and substance use services is creating a system of care for children and young adults. This includes inpatient services for youth 17 to 26 who need hospital care, enhancing youth crisis response outreach, providing early psychosis intervention programs, creating a new substance use outreach team for youth, and establishing a youth system navigator. These services strengthen connections for youth to community services and provide support after an emergency department visit or hospital stay. Patient feedback has played and continues to play a significant role in improving service delivery. In mid-April, in a few weeks, we will be launching a survey on our website, asking people who have received mental health services or know someone who has received care, what's worked for them and where improvements can be made. We are also continuing the important work of increasing services and supports for the most vulnerable people living with complex mental health and substance use, many of whom are homeless or risk eviction. Recently, the Minister of Mental Health and Addictions, Sheila Malcolmson, announced complex care services that will be available in supported housing for 100 people in Greater Victoria area. In complex care, residents can access services where they live, including care from social workers, nurses, peer workers, and other health professionals, along with connections to treatment and other specialized services. Supportive housing is another area where we have seen significant advances. Since the beginning of the pandemic, more than 800 people have been housed in BC Housing supportive housing units on the South Island. People who were formerly unhoused now have a home and support from integrated teams delivering harm reduction, addiction medicine, primary care, and other healthcare services. I want to thank the province and the Ministry of Mental Health and Addictions for their continued support and investment, BC Housing, and our many partners who support and deliver this work. The complexity of mental health is one that we cannot solve alone. It will continue to take the efforts of many partners, all levels of government, health providers, and each of us as individuals. We know housing combined with these services result in reduced visits to the emergency department, better treatment of chronic disease, such as diabetes, and rapid access to rapid response in the event of drug poisoning. We also know if clients feel welcomed and respected, they will access care when they need it. That is why it's so important we address stigma in the healthcare system. Dr. Hoyano spoke of our other public health emergency, the toxic drug supply. 327 Island Health residents died as a result of the toxic drug supply in 2021 alone. This is by far the deadliest year since the public health emergency was declared in 2016. We've lost 9,227 British Columbians to illicit drug poisoning up to January of this year. These are sons, daughters, mothers, fathers, brothers, and sisters. If we held a minute of silence for each person, we'd be silent for almost 6.5 days. We know from the recent coroner's report, many people who die from drug poisoning engage with health services in the year before their death. We also know people who use substances often confront stigma when they access care. They may fear judgment or worry about putting their work or relationships in jeopardy. This results in isolation and contributes to people using alone, which is an added risk for overdose or death. To help address this, Island Health will be launching a campaign to reduce stigma by building trust with the people who receive our care. Another area of focus for us is our Indigenous-specific anti-racism work. We recognize Indigenous people have experienced inequity for generations, including within the healthcare system. No one should ever experience racism in their care journey, and we are committed to ensuring culturally safe care where every patient feels heard and respected. All of us, all Island Health employees, physicians, contractors, students, community support professionals, and volunteers are responsible for creating that culturally safe environment. Too many Indigenous people have had their care negatively impacted by assumptions and biases rooted in racism. Our strategic plan identifies the commitment to address Indigenous-specific anti-racism within the organization as a key priority. We acknowledge our responsibility to be part of upholding this standard and creating a culture and environment that supports person-centered health and care free from discrimination, racism, and stigma. Another area of concern for many people is access to a primary care provider. This is a long-standing challenge, well over a decade on Vancouver Island and across British Columbia and Canada. The impacts of the pandemic, both for patients needing access and on care providers' own health and wellness, has worsened this situation. As we have seen, the past few months have been even more challenging when it comes to accessing primary care in Greater Victoria. We've seen clinics announce closures, with some family doctors leaving their practice to go to other care settings or to retire. I want to assure you, we are working closely with partners, including the Ministry of Health, the Doctors of BC, and in our community, the two divisions of family practice, the Victoria Division and the South Island Division. We are grateful for the opportunity to work collaboratively with them. Over the past 3 years, with the support of the province and our partners, we've invested in team-based care in physician offices, established urgent and primary care centers, community health centers, and nurse practitioner clinics. This includes opening 5 urgent and primary care centers: the West Shore, James Bay, North Quadra, downtown Victoria, and Esquimalt. We're also working with partners to establish or expand community health centers to serve the needs of vulnerable populations who have additional barriers to accessing health and care. Earlier this month, we were proud to announce the opening of Luther Court, which focuses on seniors and people living with mental health and substance use conditions. At the Island Sexual Health Community Health Center, we have increased primary care capacity and access to sexual health services. And the West Shore Community Health Center has been announced for the growing West Shore communities. This clinic will focus on people with mental health and substance use, chronic health conditions, and Indigenous people and gender diverse people. We know these investments are making a difference and will continue to make a bigger difference as they build out to their full capacity. We also know we have much, much more work to do to address the primary care needs in our community. Another area significantly impacted by COVID-19 has been elective surgeries. Just over 2,000 non-urgent scheduled surgeries were postponed from September until February 18th across the island. Although they are considered non-urgent, we understand the impact delays on cataract surgeries, joint replacements, and other procedures have on people and families who are waiting, and we want to thank you for your patience. With the support of the Ministry of Health, the Surgical Renewal Program continues to be a focus. And as of January 31st, all sites on the island have resumed elective surgeries, and we are working with surgeons' offices to ensure that postponed surgeries are rescheduled at the earliest possible time. We have an incredible healthcare team in Greater Victoria who are committed to the people of this region. The board and our leadership team truly appreciate their dedication to this work. Thank you to everyone who has joined us for taking the time to be here tonight. I know we have received questions on these and on other topics, and I look forward to sharing more during the question and answer section.
Thank you, Kathy. Now let's turn to the questions. We'll start with some questions submitted in advance, and we'll do our best to get through as many questions as we can tonight. Kathy, would you like to share the first question?
Sure, I'd love to. We heard a question from Holly, who recently visited the emergency department at Victoria General Hospital. Holly indicated her contact with the emergency department was positive, but her concern was having to wait outside for an hour without access to a washroom facility, and once she was triaged, having to wait 7 hours before seeing a doctor. Elin, I'm wondering if you can respond to Holly's question.
Sure, thanks, Kathy. I'll start with saying I really appreciate the question, Holly. It sounds like you were at the emergency department at Vic General on a really busy day. There's two aspects to your question. One is related to our COVID protocols and how we're screening patients. And then the other is about the work that we're doing in our emergency department to better flow people through, to reduce the wait, and to better serve. In relationship to the question about waiting outside, as part of the response to COVID, we developed a pre-screening process, which was standard across the health authorities. We're pivoting that process right now. So we're trying to move to a more normal state, have people so they aren't waiting outside. So we will be improving that substantially. And I want to apologize for you waiting for an hour outside. That's not a positive experience. The issue of waiting for 7 hours, waiting to be seen. Obviously, we triage patients as they come in, and people with the most urgent need get seen first. So it's some people do wait longer. Typically, our average wait is around 2 hours. 90% of the time, it's 4.25 hours. So this was obviously a really busy day. We have seen our volumes go up in the emergency department. We're going to talk more about primary care and how we're supporting primary care as we go through this evening. And things have improved at VGH a bit at this point. So one thing that we are doing is we're really trying to look at how we're flowing people through the emergency department. And we're creating a number of spaces that will support people with lower acuity problems to be streamed out of the emergency department into a different location in the hospital. We're also looking at how we can fast track things like procedures, people who need casts and those types of things. The last thing I'll say is at Vic General, we've made a commitment, and the Victoria Hospital Foundation is partnering with us on this and supporting us to move our neuro outpatient program to the Gorge Road Hospital. This is going to free up a very large space behind the emergency department. And so we're going to improve the overall flow and how we're able to stream people through. And I hope for Holly and for everyone else who uses that emergency department that it's going to improve your experience as well. We do have a patient care quality office. I just want to remind people of that. Our social team will provide the links for information to that. And we encourage everyone who has an experience they want to share with us, whether it's some feedback for us, some constructive feedback or a compliment. We encourage people to use that, and it really helps us. So thanks a lot, Holly.
Thanks very much, Elin. Elin and others have mentioned primary care, and we realize that it's a challenge for many people in the Greater Victoria region and beyond. The concern is evident by the number of questions about the shortage of primary care providers, the closing of walk-in clinics, and family doctors leaving their practices. Questions submitted pointed to the importance of continuity of care by a primary care provider for treating complex medical issues, prevention, and the overall ability for people to stay healthy. When we look at the overall health system, Family doctors and nurse practitioners are directly providing essential care to patients in the community before they arrive at Island Health. Some questions acknowledge work underway with expanding the use of nurse practitioners, delivery of virtual care, and the opening of primary care centers, such as UPCCs. However, the overarching question was, what are we doing to ensure people have a family primary care provider? I want to thank Tom, Isolde, Val, and ER for bringing this question forward. And Dr. McDonald, I wonder if you would respond, please.
Yes, of course. And thank you to Tom and the others who have asked these questions, because they're so important for us to address. And I know they're on the minds of many of you listening at home tonight. So as a physician myself, I am extremely passionate about the role of the family doctor or nurse practitioner. We know, and research shows us, that people that are connected to primary care providers have better health outcomes. And in the end, they actually use less healthcare resources because we're able to take a preventative approach rather than just responding to emergencies and putting out fires. Primary care is described as the backbone of the healthcare system. And when that is not strong and in place, the rest of the system just doesn't function as well. And it's so much harder for people to navigate. And I just want to stress how I really do see and appreciate the stress that this brings for many people. And it's not infrequent that I am asked by friends or neighbors, or sometimes it's patients that I'm seeing in the hospital, how they can get a family doctor or nurse practitioner because theirs has recently retired or relocated, etc. But as Kathy has referenced, these challenges in primary care have been with us for some time now. And the reality is we do have shortages with healthcare professionals, provincially, nationally, and even internationally. However, I do want to talk about the progress being made. And I know that was the question, what are we doing about this? And I think it is key to understand that there are large investments being made in primary care right now, and new models of care are being developed. We're really in a time of transformation and opportunity. So Island Health is a partner in the South Island Primary Care Networks, along with the divisions of family practice and their members, our local physicians, and supported by the Ministry of Health and Doctors of BC. And it's through these networks that significant investments are being made in primary care. And these are investments both to increase access. So some of that is same day access, after hours access that we see through urgent care, etc. But also to focus on attachment, which is important, as we discussed, that being known by a family doctor, nurse practitioner, sometimes a team or clinic. I want to give some concrete examples of some of these investments. The primary care networks started to be developed in 2018. And over these past number of years that they have been growing and developing, over 175 positions have been added to primary care in the Greater Victoria area. So some of these positions are team-based care. So it's RNs and social worker counselors that are working in existing physician offices to expand the scope of care that can be provided there, help look after that panel of patients. And some of those resources are going into new clinics, as Kathy referenced. So nurse practitioner-led clinics, our community health clinics that are starting, and the urgent and primary care clinics. And I want to stress how important these new models of care are. While we absolutely have to support our private practices as well, we know that new graduates are looking to practice in new ways, in interdisciplinary teams, often where they don't have to be the owner operator of a clinic, that they can focus on providing medicine. And this is what these new model of clinics are doing. And we're seeing this really come to fruition with more recruitment happening just in this last fiscal year. There's been almost 4 equivalent physician, and I talk about physician equivalents because sometimes more than one physician can take on the one role, but almost 4 hired on to community health centers, almost 8 in our urgent and primary care clinics, and over 20 physicians have taken on primary care network contracts where they're able to now operate under a service contract as opposed to the traditional fee-for-service. So absolutely a lot is happening in this space. And as Kathy referenced, we also have a long way to go and lots of work to do. But I can assure you that this is a key focus of all the partners of the primary care network. And I will just mention, for those of you looking for a family doctor or nurse practitioner, I do encourage you to reach out to the HealthLink BC or through 811, and more resources can be provided, and the social media team will post some links there for you.
Thank you, Dr. McDonald. A really important topic for all of us, I think, myself included, as somebody who's also without a family physician. Charlene has brought up an important question on accessing healthcare. She requires accessible parking for side ramp vans, which makes it incredibly stressful for her to find safe parking when she needs to access care at one of our facilities. I want to thank Charlene for coming forward with her question. I've asked our team to reach out to her and follow up on this so that we can understand specifically what sites are problematic for her. The next questions are from Shaylee, Celeste, and Sally regarding supporting those with eating disorders. The first question is on our progress in developing, implementing, and evaluating a regional strategic plan for eating disorders. That's the first question. And Shaylee also asks about staff training and bringing in those with lived experience. Keva, I'm wondering if you might be able to respond to the questions.
Thanks, Kathy. I'd be happy to. And thanks, Shaylee, Celeste, and Sally for both of those questions. Eating disorders is such a tenacious illness, and for many people it is also quite chronic, and they suffer from it for many, many years. And so for us as a health authority, having a plan for our services and for how we're delivering those is absolutely key. And when we look at the mortality rate for eating disorders, which is one of the highest of all mental illnesses, it makes it particularly relevant and important. So I really do appreciate that question. Last year in 2021, we received $1.2 million from the province to support us in expanding our services for eating disorders. And in part, we have used that funding to develop a plan, a regional plan for eating disorders. And this is a refresh of an earlier plan. And in this case, what we're doing is looking to restructure our eating disorder services into more of a hub and a spoke approach. So recognizing that our specialists in this area are limited on the island, how do we make sure that we really optimize their reach? And so as a result, that's the approach that we're taking. And when we look at, each pathway into illness is quite unique and looks different, and so does each pathway to recovery. And so this question about client and family inclusion and peer support is so relevant, because we want to make sure that we're structuring our services in a way that are responsive and also flexible for individuals, and recognize that range of different experiences. So in terms of the second question, Shaylee, around peer support and how peers are supporting staff and training, one of the things that we've done in our PsychEmerge is develop a peer curriculum to support peers who are working in PsychEmerge, as well as to support the staff to understand how important it is to have peers on side and working beside our clinicians. So that's one thing we've done. And then the other is that we've put out a request for proposal for an additional, or to expand on our peer services in acute care. And that would include our care for people who are struggling with eating disorders. So again, thank you for the question. And that's all.
Thanks, Keva. Linda has a question about additional booster shots. She takes an immunosuppressant, and when she received her third COVID shot, was told that because she was immunosuppressed, she needed 3 to complete her initial series and would receive a booster in 6 more months. That was 5.5 months ago, and there has been no mention of a 4th, or what she calls a booster. So her question is, there's still a plan for additional boosters. Dee, could you answer that question?
Sure. So for people like Linda who have mild to severe immunocompromise, they are eligible for a primary series of 3 doses. And so it sounds like that's what Linda had. And then after 6 months, then they're eligible for the booster dose. So for the most people, you should be receiving a reminder to book an appointment for a booster dose through the Immunize BC portal. So for some people, that might be getting the text message or an email. And so I hope Linda's received that invitation already to book her booster dose. If she or other people are in that situation where they have not heard, then I would suggest they contact the provincial immunization number, and that they can help out there and make sure that they get booked in for their booster dose. Yeah.
Thank you, Dee. There's a theme, I think, in many of our responses, and the theme is that Island Health can't do anything alone, and almost everything that we do in terms of responding to community needs and developing health and care services reflects some kind of partnership, either with our divisions of family practice, our nonprofit providers, BC Housing. You've heard of many partnerships already this evening. Amy asks a question about how Island Health mental health team works with other organizations to support clients, and in particular, how our mobile crisis response team and urgent short-term treatment and assessment teams work with others. Keva, I'm wondering if you might be able to answer Amy's question.
Yeah, I'd be happy to. Thanks, Kathy, and thanks, Amy, for the question. I'll answer it in 2 parts. So the first part, as I understood it, is the mobile crisis response team and how that works with other organizations. So our mobile crisis response team provides outreach service for people who are in mental health, experiencing a mental health crisis. And we partner with the Saanich and Vic PD police, and we partner with the Ministry of Children and Family Development to deliver that service. So as a cohesive whole, we go out together, and that has proven to be very successful and very supportive for the vast majority of the people who we're going out to in community who are in crisis. So that's the mobile crisis response team. The urgent short-term treatment and assessment team, they support people for over a short period of time who are experiencing a mental health crisis. And in this case, we call them USTAT, the urgent short-term treatment and assessment. They partner with or connect with primary healthcare providers, private clinicians in the community, and also community counseling organizations. But all of those connections are premised on the client's consent. And they can also link and reach out to family members. But again, it depends on the client's interest and consent. So in the case of USTAT, it's a little different and more based on the client's interest in the information being shared.
Thanks, Keva. So Kevin asks what Island Health is doing to improve access to basic lab services with the closure of Life Lab sites. He expresses concern with appointments booking up to a month out and wait times for unscheduled times that are hours long. Elin, I wonder if you would answer that question.
Yeah, sure. Thanks, Leah. Access to lab services in the South Island, but actually across Vancouver Island, has become quite challenging. I think one thing that most of us may not have seen as an impact of COVID was on lab services. It, of course, carried the burden of testing for COVID, and it really was a area of great stress across BC, and in fact across Canada. We have a medical lab assistant shortage, and through the COVID pandemic, this has worsened significantly. So Life Labs and Island Health through the pandemic had to reduce outpatient hours, and some outpatient clinics were closed. That is starting to reverse, and we have a very robust plan at Island Health to support improved recruitment, improved training, and so we will be seeing many more students than we normally do coming through and supporting them. For the South Island, we are also going to be opening up the Keating Lab site for Island Health, and Life Labs will be opening up their Yarrow site. So things should be improving. We will post in the social posts and in the links how people get access. So there's two ways you can book an appointment, and this is problematic because many people need blood work. They've seen their doctor, they need to go get blood work, and to book an appointment, you can have to book a month out. You can also reserve a spot. And so there's a way to do that using Island Health's Wait While Lab, and there's also a way to do that with Life Lab Save My Spot. We'll post that information for you. I do want to say I'm working with our outpatient lab team to ensure a couple of things. One is that if someone needs outpatient lab work quickly for things like coagulation, that we're able to get them in same day, and that for elderly people that they don't have to come and wait for a long time. So both of those things we're going to be working on, and we'll bring more information and provide that to the public. Thanks very much, Kevin.
Thanks, Elin. And before we go to the live questions, I have one more for you. One of the pre-submitted questions from Ken regarding a referral for a CT scan that he had booked last fall, and it's now been rescheduled for April. He says this wait has made his situation incredibly difficult, and he wants to know how Island Health is working to decrease wait times for those diagnostic tests. Do you have any answers for him?
Yeah, thanks, Kathy. And I'm going to be brief on this to allow us to get some live questions in, but that's a long wait, Ken, and I really feel for that. We have four different prioritizations for diagnostic imaging, both for CTs and for MRIs. And if you're not in an urgent or emergent category, it can be a long wait. I will say we've increased by about 20,000 scans a year. We do 157,000 CT scans every year on Vancouver Island. So it's a high demand area. And though we've increased by 20,000 over the last year and a half, like through COVID, our overall demand has also increased. So we are working hard to ensure we're doing as many scans as possible. We also have a process in place that people can choose to get a scan in a community that they don't live in, so anywhere on the island, and choose for the shortest wait. What I would say to anyone who is waiting, if you feel like your condition is changing, please go back to your doctor. They can re-refer you. They can change the priority. They can call our medical imaging department, and we'll do everything we can to support you in getting access.
Thanks very much, Elin. So we're now going to turn to the live questions, and thank you to everyone who has submitted a question, and thank you to the social media team who is monitoring our social media channels and responding to questions online during the event. Our first live question is for Dr. McDonald, and it's from Camille, who's with the group BC Health Care Matters. And Camille's question is, do you consider UPCs a solution to the family doctor shortage when many aren't able to attach patients to a doctor?
Thanks, Camille, for the question. And I think, yes, they are part of the solution. They're certainly not the only solution. They are making a difference. We're proud of the fact that since the 5 have come online over the last 3.5 years, they've seen over 200,000 patient visits. So they are making a difference, and we are trying to increase capacity for attachment. We've had some of those new physician and nurse practitioner positions that I talked about recently being added to the UPCCs. They are people that are going to start taking on panels. We will see that attachment grow over time. And as the UPCCs come up to their full complement, we will see much more of that. But again, remembering that the UPCCs are one part of the larger primary care strategy, and investments are also being made in existing family practice offices and the other types of clinics we talked about, CHCs and nurse practitioner clinics as well. So it's all part of a larger system.
Thank you, Dr. McDonald. This is a question for Dee from Amy. Amy's wondering if there are any updates or rough timelines on when COVID-19 vaccinations will be available for those who are under 5 years old. Dee?
Okay. So what I can tell you is that this is under review. The way it works to get vaccines approved for different populations, it does need to go through a national process. So my understanding is that this is underway. And then once that happens, then we'll have, if it's approved, we'll have a vaccination available for the younger age groups. Unfortunately, though, I cannot tell you an exact timeline of that. I know one of the issues is that part of the work that needs to be done to get approval for vaccine is that it needs to be, there needs to be studies done on that specific population and look at the safety and the efficacy. And so that work, from what I understand, still is ongoing, and the pharmaceutical companies really need to prepare all that information for the Health Canada regulators to look at.
Thanks very much, Dee. The next question is for Keva, and it's from Tara Harper. And Tara's question is, youth mental health care is in crisis. Wait lists are too long and supports are deeply inadequate. The issues are systemic and need a full review. What is being done to truly support youth in crisis?
Yes, so this question is spot on, no question. Like we have a real crisis, and we see it in our numbers of presentations to emerge. We see it in our number of admissions. And we have a shared response with the Ministry of Children and Family on that. We have a shared responsibility. The Ministry of Children and Family has responsibility for community mental health, and Island Health, we have responsibility for inpatient and for tertiary services. And what we're doing is we are creating a young adults program section within the Psych Emerge, the PES that Kathy mentioned earlier at the Royal Jubilee Hospital. That will be, we're having a planned opening of 2023, very early in 2023. And we're also looking at our acute and tertiary services. So Jack Ledger House and Victoria General Hospital, where we have a pediatric unit, and we're looking intensively right now at how we can restructure those services to improve access and to strengthen the quality of services. So lots to be done in this area, and absolutely it's a priority for us right now.
Thanks so much, Keva. Unfortunately, we've come very close to the end of our time, and we just never have enough time to answer all the questions, but I hope that at least some of the answers have been helpful to you who are watching. As a board, we rely on our local teams of healthcare leaders to ensure we are taking the right steps to closely align with the needs of the community. We are extraordinarily fortunate to have both Keva and Dr. McDonald leading two incredibly important areas of work in this region. Thank you for your dedication to the people we serve. I now invite Kathy to say a few closing remarks. Kathy?
Thank you, Leah. And once again, I'll put in a notice, I guess, encouraging all of us, if you have not been vaccinated, as we know that this virus is still in our community, the evidence is showing that vaccines are safe and effective at preventing serious illness and death. It may not prevent you from catching the virus, but it protects you from getting really sick or from dying. And so I encourage everyone to get fully vaccinated and protect themselves and their loved ones from this virus. I want to thank the pharmacies who've partnered with us and public health clinics who will continue to deliver vaccinations. And so they will continue as long as people keep coming. I also want to take this opportunity to express my heartfelt thanks, and I know the thanks of our team, to the Island Health employees, the medical and clinical staff, who often work in very challenging circumstances, and we've heard many of them this evening. And they work so hard and they come back every day to help bring our vision of excellent health and care for everyone, everywhere, every time to life. We are so indebted to them for their dedication to the people we serve. And thank you, all of you, for taking your time this evening. It's obviously a sign of how much this community cares about health and care.
Thank you, Kathy. Kathy and I have been co-hosts, as I mentioned at the beginning, and particularly thank you to panel members Dr. Hoyano, Keva, Dr. McDonald, and Elin. Thank you to the staff, physicians, clinicians, and partners who continue to approach health and care with compassion and commitment. Thank you once again to those who submitted questions and joined us live this evening.